Welcome. In this explainer, we are going to break down the standard surgical options for local testicular cancer. We're going to cover the procedures themselves, some of the key decisions you might face, and of course, the long-term quality of life considerations. Everything we'll talk about is based on the latest clinical understanding.
So let's just dive right in. And the first thing to know might actually be the most surprising one. The core surgical treatment for testicular cancer, it's been the gold standard for over a century. That's an absolutely incredible track record in medicine, and it really establishes a foundation of a highly effective, trusted treatment.
So here's our roadmap for today. We're going to start with that century of treatment, and then we'll get into the details of the standard operation. After that, we'll tackle the debate around biopsies, explore an organ-sparing option that's available in specific cases, and then we'll wrap up by focusing on what really matters in the long run, quality of life. All right, Section 1, a century of treatment. We're starting here because it's so important to understand there's a long-established gold standard. The procedure is called high inguinal orchiectomy, and it has been the most effective local treatment for over 100 years.
Okay, that brings us to Section 2, the standard operation. So what is an inguinal orchiectomy? Let's break down exactly what this procedure actually is.
Let's demystify that name first. Inguinal just refers to the groin area, and orchiectomy means removal of the testis. Simple as that. So an inguinal orchiectomy is the surgical removal of the affected testis and the entire spermatic cord, all through a small incision in the groin. And as you'll see, that specific approach is really, really important. The operation itself really happens in 3 key phases. First, that incision is made in the groin. Second, the surgeon carefully isolates the spermatic cord. And finally, the testis is removed and the cord is resected way high up. The whole focus here is on a clean, controlled removal. Now here's the crucial point. This operation does so much more than just remove the tumor. The analysis of that tissue, combined with blood tests and imaging, gives doctors the complete picture. And that information becomes the absolute foundation for every single decision that comes next, like whether or not any further therapy is even needed. So why is going through the groin so critical? Well, the data tells the whole story. Look at this. The standard inguinal approach has a local relapse rate of just 0.4%. But if the scrotum is entered, what's called a scrotal violation, that rate jumps all the way to 2.9%. That is a huge difference, and it really highlights why this technique is so important. Okay, let's move on to our third section. The biopsy debate. This is where things get a little more nuanced. We've dealt with the testes that has the tumor, but what about the other one? And that really is the question at the heart of an ongoing medical debate. Should surgeons just routinely take a biopsy from the other seemingly healthy testis during that first surgery? It's not as simple as it sounds. See, the whole reason to do a biopsy is to check for a precancerous condition called GCNIS. And yeah, detecting it early is obviously a good thing. But here's the catch. The incidence, how often it actually shows up, is pretty low. So the big debate is whether the benefit of finding those few rare cases is worth the risks of doing a biopsy on every single patient. So instead of making it a routine thing for everyone, the general consensus is to just discuss a biopsy with patients who have certain risk factors. We're talking about things like testicular atrophy, which just means a smaller testis, being younger than 40, having a history of an undescended testis, or having limited sperm production. It makes the decision a lot more personalized. All right, on to Section 4. Now, while that inguinal orchiectomy is the standard of care, it's not the only option out there. In some very specific situations, an organ-sparing surgery might actually be on the table. So what are those specific situations? Well, we're mostly talking about cases where a patient has a tumor in their only remaining testes, or if they unfortunately have tumors in both testes at the same time. The goal in these cases is to try and preserve the body's natural hormone function if at all possible. But this presents a really clear trade-off. On one hand, you have the standard orchiectomy. It's effective and you don't need any more local treatment. On the other hand, testis-sparing surgery can preserve that hormonal function, but, and this is a really significant but, it comes with a major, non-negotiable requirement. And here it is. With testis-sparing surgery, radiation therapy isn't just a suggestion, it's obligatory. You have to have it. That's because in pretty much all of these cases, those precancerous GCNIS cells are found in the surrounding tissue, so the radiation is required to clean those up.
And the direct consequence of that obligatory radiation is profound. It results in infertility. This makes the decision incredibly personal and complex. You're weighing the preservation of your natural hormones against the permanent loss of fertility. It's a heavy choice.
Okay, let's move to our final section. And honestly, this is a really important one. Because testicular cancer is such a highly curable disease, the focus for doctors and patients has really started to shift to long-term quality of life for survivors. That includes things like psychosexual health and body image. And that brings us to the topic of testicular prostheses. Now, the decision to get an implant is 100% personal. The data shows that a pretty big chunk of patients, somewhere between 30 and 50%, we're showing 40% here, do choose to get one. So it's a common choice, but it is definitely not for everyone.
And here's some really important and reassuring information for patients. If you do choose to get a prosthesis, it can be safely implanted right there during the main surgery. This integrated approach means it doesn't delay or interfere with any other cancer treatments you might need down the line. So we're going to end with this question because it really gets to the heart of modern testicular cancer care. It's not just about curing the disease anymore, it's about finding the absolute best path for each individual person. In a cancer that's so curable, how do we best balance the most effective treatment with the long-term quality of life that every single survivor deserves to have?